Hello everyone. Today we will read Pharmac. Some drugs and its specific side effects, which are PYQs. So first, we all know that vancomycin has a side effect, Redman syndrome. But here is some another point that niacin also causes Redman syndrome. This vancomycin Redman syndrome is due to histamine, and this niacin is due to prostaglandins. So this is it. And for nitrates and amiodarone, you all know that amiodarone causes blue man syndrome, but along with amiodarone, nitrates also causes blue man syndrome. Now tamsulosin, which is alpha 1A antagonist, it causes floppy iris syndrome. And lithium and benzodiazepine causes floppy baby syndrome. Misoprostol causes M4M Mobius syndrome. Now tetracycline causes Fanconi syndrome. Here we are reading syndromes together, that which drug causes which syndromes. So tetracycline causes Fanconi syndrome. I am using this symbol for syndrome. Tetracycline causes Fanconi syndrome, and some other side effects also. Pillai induced esophagitis. Pillai induced esophagitis, and it causes calcification of tissues. Calcification of tissues like bone and teeth. It also causes enamel hypoplasia. So most of them are PYQs. Okay. Now linezolid, it causes serotonin syndrome. Or along with that, it also causes bone marrow suppression, or you can say pancytopenia. Phenytoin, on the other hand, causes purple glove syndrome. It has many other side effects also, like osteomalacia, gingival hyperplasia, but this is the syndrome, purple glove syndrome. Warfarin causes, on the other hand, purple toe syndrome. Now phototherapy. Phototherapy causes bronze baby syndrome. Bronze baby syndrome. Now chloramphenicol, it causes gray baby syndrome. It causes gray baby syndrome. And as we read the chloramphenicol, so remember fluoroquinolone causes tendon rupture. Therefore contraindicated in childs. And few other antibiotics also, like sulfonamide, it causes Sicca syndrome. And it causes kernicterus in baby. If consumed by mothers, it causes kernicterus in baby. Erythromycin, it causes jaundice in mother. And it causes CHPS in infants. If mother takes erythromycin during the pregnancy, it also causes cholestasis. Now ceftriaxone, another antimicrobial, it causes pseudocholestasis syndrome. Now 5-fluorouracil, it causes hand and foot syndrome. Now some other anti-cancer drugs like paclitaxel, it causes glove and stocking neuropathy. 5-fluorouracil, hand and foot, and paclitaxel, glove and stocking neuropathy. Okay. And streptozocin, it causes which is also an alkylating agent. It causes diabetes mellitus by beta cell destruction. By beta cell destruction. Anthracycline and doxorubicin, which you all must be knowing that it causes radiation recall syndrome. I'm just enumerating here. Radiation recall syndrome, and it is cardiotoxic. It causes cardiotoxicity, for which the treatment is dexaroxazone. Maybe my spelling is wrong, but dexaroxazone. And cyclophosphamide, it causes hemorrhagic cystitis. You all know hemorrhagic cystitis. And it causes lung fibrosis. You all know there are other drugs also which causes lung fibrosis, like carmustane, busulfan. Okay, but this drug also causes lung fibrosis. Along with that, it causes infertility also. This is a pyq. And it causes secondary leukemia as well. Now, cyclophosphamide was causing lung fibrosis. Here, pergolide is another drug which causes heart and lung both fibrosis. Heart and lung fibrosis. Now, trastuzumab, you all know, cardiomyopathy is cardiotoxic. It is. Now, amifostine, it is radio and chemosensitizer. Radio and chemoprotector, sorry. Radio and chemoprotector. Okay. Now, temozolomide. Temozolomide is an alkylating agent. It is looking like carbonic anhydrase inhibitors, but it is an alkylating agent. So, acetazolamide is a carbonic anhydrase inhibitor. Okay, you all know. Temozolomide looks like carbonic anhydrase inhibitor, zolamide, but it is an alkylating agent. That is why I have written both of them together. So, acetazolamide is carbonic anhydrase inhibitors. It increases the risk of sickle cell anemia, and it causes metabolic acidosis. Filgrastim, that is GCSF, it also increases the risk of sickle cell anemia. Okay, and GMCSF is MO. GMCSF, it contains MO, so sargramostim, MO. Okay, GMCSF. Now, thalidomide, it causes phocomelia. You all know phocomelia is a very common side effect. You all know that phocomelia causes, but there are other side effects also, which is pyq, is it causes constipation and peripheral neuropathy. DVT, sedation. These were options, DVT, sedation, but constipation and peripheral neuropathy are PYQs. So this is it. Some microbials we read, some cancer drugs we read. So this was the part 1 of drugs, and I have certain drugs also for part 2. So this is it for today. Thank you.